Chairman Platts and Ranking Member Towns, I thank you so much for your consideration and graciousness allowing me to be able to testify briefly before this committee today on this critical program. And I thank you also for the bipartisan way in which this committee is moving forward on this subject, as we are on the cusp of a major expansion in Medicaid in the United States. It's more important than ever, and I commend this committee for taking up this important issue of vouchsafing the expenditure of the people's money, and I thank you for that. In April, I testified in a joint hearing of 2 Oversight Committee subcommittees on the complete lack of reporting, collection, and verification of meaningful data in Medicaid. I underscore what I just said. That's a breathtaking statement. There is a complete lack of reporting, collection, and verification of meaningful data in Medicaid. The same is not true for Medicare. That's why this is a bipartisan issue, and one that we hope will focus on helping the needs of the poorest among us in the United States, who must have these program monies in order to survive. The staff report from that hearing stated, quote, Minnesota provides a stunning example of how states are failing to properly ensure the appropriate use of taxpayer dollars spent on Medicaid managed care. This is something we are not proud of. In order for states to ensure the appropriate use of taxpayer dollars, they must be able and willing to collect the data that shows how much is paid in a claim, for what, and to whom. That's only basic common decency. Since the investigation into Minnesota Medicaid fraud has unfolded, several implicated parties have begun to offer up excuses. According to the Trade Organization for Managed Care Organizations, the Department of Human Services actually has the data, but not the ability to analyze it. They say the state's computer system is too antiquated. But in contradiction to this, a DHS assistant commissioner said the data is, quote, literally analyzed by DHS on a daily basis and has been for years. So now either the trade association representing the health plans is fudging or DHS is. We need to find out who. It's our job to immediately get to the bottom of this, and I thank the committee for what you're doing. CMS is already tasked with identifying patterns or instances of fraud and abuse in Medicare and Medicaid. That much we know, and that much is good. But despite that, they require no documented data. Now, the two don't go together. You can't do your job if you don't have documented data. That is why this month I am introducing a bill that will hold CMS accountable to ensure stated audits are conducted properly. That's why this is totally bipartisan, a bipartisan bill. We just want to know where the people's money is going, and is it going to help the poor people in this country who need these services. But because this situation needs immediate attention, I'm proud to announce that I'm sending a letter today to CMS calling for an immediate third-party independent audit of Minnesota's books. We can't allow taxpayer dollars to flow without proper record-keeping ever again. Thank you again to the committee for your fine work, Ranking Member Towns, and also for your fine work, Chairman Platts. I am thrilled to be a partner with you in this important work that you are doing, and I yield back. Thank you again, Mr. Chair, and also Ranking Member Towns. One area to look for fraud is with the Medicaid providers. Another is with the Medicaid or the managed care organizations. And this would be a question for Dr. Bedetti, if you will. And just briefly, based on the concerns that the managed care organizations are using Medicaid premium dollars to cross-subsidize other non-Medicaid state health plans, could you tell the committee what data you're gathering to combat these allegations, if any?
So, Congresswoman, I think that you're aware that in your state, in Minnesota, that after discussions with CMS that have been ongoing recently, that Minnesota has recently agreed to repay to CMS the appropriate federal share of the amount of money that was contested. And we're currently reviewing the state's submission on that matter and have every intention of collecting the appropriate federal share. We are also looking
But if I could ask Dr. Bedetti, how are they coming to the conclusion of what number? Because my question is about what data are you gathering so that we can be confident that states aren't taking Medicaid dollars and then using them for a cross purpose to subsidize a non-Medicaid, non-federal Medicaid state health plan? What specific data are you asking the states for so we can be assured this isn't going on?
I think that that question is very well taken. I think that we need to continue to build our capacity to collect the appropriate data on managed care operations.
So we aren't collecting any data to that effect today.
The emphasis has been on the fee-for-service side. I agree with you on that.
So we need to do better. It sounds like
we do need to do a better job in terms of getting that degree of oversight.
Thank you.
And we are engaging in doing that.
And I agree. I think that shows a big hole that we have because we're not even asking the right questions. And I think that goes to Ranking Member Towns. The right question was asked of him at 1:30 in the morning. That's what we need to be doing, asking the right question. Clearly, we're not. Let me ask you also, Dr. Bedetti, since 2006, CMS has now spent over $100 million developing the One Program Integrity System to merge Medicare and Medicaid data. And the Medicare data has been collected, but to date the Medicaid data has not been included. Now, this is significant. It's been 6 years. Why is that the Medicaid data is not included, and what role should the states play in, or are they perhaps in delaying the collection of this data, and are states withholding information from CMS?
We certainly recognize that the data that we have been getting from the states are not adequate, and that's been at the core of our restructuring of the National Audit Program. We've been working very diligently over the last couple of years to improve that situation and to get the right kind of data. There's a demonstration project going on with 10 states that's designed to look at the data that we're currently collecting, to identify the data that we do need to do proper oversight, and as well as a number of other program operation requirements at the Federal level, and then to get those data from those 10 states and to use that as a model for improving the flow of data from the states.
Well, I would agree, but that doesn't answer my question why for 6 years we have Medicare data, but we don't have Medicaid. There's just an absence. So the question is the state holding out on us? Are they not giving the data? Are we not holding them accountable? So if you could get back to the committee and answer that question. I just have one question for Ms. Yoakum, if you could answer that also in the brief time I have. The GAO lists Medicaid as a high-risk program, and GAO has previously issued reports that address CMS's lack of oversight into Medicaid managed care rates. So given that we have 3/4 of Medicaid beneficiaries enrolled in some form of managed care, could you speak to the data that's used by GAO and CMS to address this aspect of Medicaid?
Certainly. Right now, one of the big issues across the Medicaid program are the different data systems and the extent to which they actually talk to each other. There are two different ways that managed care data may be collected. One is through its expenditure system. The second is through a separate accounting system that looks at the managed care reporting itself. Our work that we looked at on actuarial soundness and Medicaid managed care, we ended up going back to state plans and to state contracts with managed care plans in order to understand CMS's review and oversight in that area.
And Mr. Chairman, I thank you for indulging me to be with the committee. It seems to me that there's a real problem in that we aren't asking the right questions. And I think we'd be a lot farther down the road if we ask the right questions. That's the purpose of my legislation that I'll be introducing shortly. But I thank the committee so much for graciously allowing me to be here today. And I thank Dr. Bedetti for getting the answers to the committee to the question that I asked.
I thank the gentlelady and Dr. Bedetti. If you would follow up in writing to the committee for the record in response to Representative Bachmann's questions. And I think the focus that you've touched on here and Ranking Member and I were speaking about is so important that unless we have that data, we really won't be able to get to the root causes and when I talk about internal controls, ultimately our goal is to get to the root causes of the improper payments, the fraud, the misuse of funds. But without the data, it's hard to know exactly where that is. So that focus, especially on the Medicaid side, is going to be so important to ultimately reducing the improper payment numbers for both Medicaid and Medicare. So I thank the gentlelady for participating. Now you